let's talk about the recovery from spinal surgery. Specifically, I want to talk about the recovery from a one-level spinal fusion. They can go home that day, up and walking that day, and I usually tell them that they need to be up and walking around their room, their hotel room, their house several times a day during those first couple days. I let them know they can go out and take walks around the block, and I kind of say just don't get your heart rate up too much. I don't really want you sweating into that area. The restriction I have in terms of activity for those first 6 weeks is I really don't want the patient lifting anything more than a milk jug during those first 6 weeks. We also use the phrase BLT, and I want them to avoid bending, lifting things, and twisting. That's just for those first 6 weeks. That helps stabilize the muscles on the back, the tissues, and the stitches I place that are all absorbable under the skin during those first 6 weeks of recovery. Also, typically, I'm going to have the patient be in a Velcro back brace. It's a medical grade back brace that provides an extra level of support to the front, side, and the back part of the spine. And that's something that does help with post-operative pain. Another thing I have the patients do is I say once you get home, you wait about 2 or 3 days after the surgery, and I want the patient at that point, day 2, to be showering with just soap and water on the back. I don't want them to get fully submerged into a bath, a hot tub, or even a lake we have here in Texas, but I do want the patient to be using soap and water to clean their incision, clean their wounds, and to be changing their dressings essentially every day. During that 6 weeks, frequently I'll order something called home health, and that's where you have a home health specialist do light physical therapy with you. They'll do light exercises, stretching, they'll also do medication management and check the wounds. And I think that's a really critical part in terms of the patient receiving optimal care. Now, in terms of a fusion, that's where at 6 weeks, we really start to change the things you're doing. At 6 weeks, I stop you using that brace, and at 6 weeks, I send you to the gym, and I make your activity limitations now up to 30 pounds. So you can lift up to 30, maybe 35 pounds now, and that's from 6 weeks up until about 3 months. I want them going to the gym with physical therapy 2 times a week for 6 weeks. We focus on quadricep strengthening, hamstring strengthening, stretching, activities that help modify the muscles and really kick them into high gear. And we start that at the 6-week follow-up point. Cycling is great during that point. Speed walking, I'm okay with running, but I just think that's a lot of pressure kind of hitting down in a repetitive nature. So I don't love running yet. If patients want to do it, okay. But I'd really like them to focus more on cycling or even stationary walking on a treadmill, for instance, from that 6 weeks to 3 months. Another thing I tell my patients is golfing. I let them go back to golfing and putting at 6 weeks, and I let them go back to a full driver maybe by 6 months, and I have a lot of other videos on that too. When the patients follow up at 3 months, and again, this is a little variable from patient to patient, I allow them to go up to 45 pounds. And especially once they get to the 6-month period, and definitely by the 9-month period, I really let them go back to almost all activities. There's a certain point, once it's all done healing, once it's all done fused, and it's totally a success at that point, I'll let patients go back to full activity. And I jokingly tell patients that could be MMA fighting, ice hockey, skydiving, wrestling. Now, I have a lot of patients that do those things, so I have to be careful when I say that because a patient might actually want to go back to those things, but that's kind of the point of surgery. If your condition is preventing you from doing the things you like to do, well then surgery might be the most reliable and one of the best options to fix that underlying pathology. So I tell patients all the time, there's something out there where they hear, oh, once you get a spinal fusion, you can't ever go running again, or you can't do this, or you can't do that. Well, that could be true if you're in your 70s and you get something called a T10 to pelvis fusion, maybe, but a 1-level, maybe even a 2-level spinal fusion, I expect my patients to get back to running, cycling, swimming. I expect them to wrestle with their kids, to help out around the house, to do heavy laboring. That's kind of the point of why we use minimally invasive techniques to do high impact surgeries to really change the anatomy of the spine and to rebuild the spine. So in terms of the recovery, the first 6 weeks is tough. After 6 weeks that's when we start formal physical therapy, and at 3 months and at 6 months we really kick it into high gear.